Age-related macular degeneration, or AMD, is the leading cause of central vision blindness in adults over the age of 50. Several million people in the United States alone are diagnosed with this condition. As of now, we have spent hundreds of millions of dollars in research and still do not really know what causes AMD. We do know that there is a genetic component. If you have a relative with AMD, you are more likely to collect macular degeneration yourself. If you have Northern European ancestry, blue eyes, fair skin, that makes you more susceptible. If you are obese, smoke cigarettes, or have ultraviolet exposure, that increases your risk. But by far, the most significant risk is just getting older. The macula is the part of the retina responsible for precision vision needed to read, write, and drive. The retina is made up of a number of photoreceptors which convert light energy into electrical signals which can be interpreted by the brain. The macula is loaded with cones which send the sort of signals that can be converted into color and into precision vision. As a person ages, circulation decreases and the macula degenerates. First, fine details are lost. Then people can see only the edges of objects, not the center. The center becomes blank or black and is called a scotoma. At that time, more intense light is needed to visualize objects. Lines can sometimes become wavy and color becomes less intense. That can deteriorate to the point of legal blindness, which is defined as best corrected vision less than 20/200. Macular degeneration comes in two varieties, wet or dry. Dry macular degeneration is by far the most common, representing 90% of the cases. Until the Santa Fe protocol, the only treatment available was high-dose supplementation with antioxidant vitamins, lutein, zinc, and zeaxanthin, which is found in dark green leafy vegetables. Those supplements managed to slow the rate of loss of vision for a portion of the people who took them. Wet AMD is by far the more scary. That's because abnormal blood vessels found in the retina can suddenly leak, leading to an immediate, sudden vision loss. This is the area where research from the ophthalmologists has developed techniques to slow that loss, most of the time using lasers or chemical interventions. The first treatment proven was thermal laser. In this, a laser was used to cauterize leaking blood vessels in the back of the eye. Unfortunate cost was an immediate 3-line loss in vision. However, over time, the people who were treated had more retained vision than the people who were untreated. Next to be developed was photodynamic therapy. This came out about 3 years ago, and in it, the drug verteprofen is injected intravenously. A cold laser is sprayed over the back of the eye, and the combination of laser plus verteprofen sealed leaking blood vessels. This had much less vision loss than the thermal laser. However, only about 40% of people with wet macular degeneration would qualify for this treatment. At the beginning of 2005, a new treatment option became available called Macugen. Macugen, or pegaptanib sodium, is an angiogenic growth factor inhibitor that stops abnormal blood vessels from growing. An ophthalmologist will numb the eye and inject the chemical inside the eyeball itself. This should be done every 6 weeks, and the cost is greater than $2,000 per treatment. The good news is 100% of people with wet macular degeneration can benefit. Some people actually improve vision. However, for most people, vision continues to be lost. My Santa Fe protocol is the only documented treatment plan that can increase vision for both wet and dry macular degeneration patients. It does so without the use of lasers or injections. Currently, 85% of people gain vision in at least one eye.